As a reminder, this conversation is being recorded. This is to ensure that other folks who are not here today are able to access the information, or perhaps to learn from the questions you may post today. Today, what we're going to do is just a little bit of brief information about the RFA, but also have an opportunity for questions and answer. I would like to pass it to my colleague, Deborah Autumn, who's going to get us started.
Good morning. My name is Deborah Autumn. I am with the Contracts and Procurement Unit for King County DCHS, focusing on the American Rescue Plan Act, the ARPA funding. And I am working with Famiers on this and other RFAs. So today we are meeting to talk about the Rural Expanded Suicide Prevention Training and Peer Behavioral Health Services RFA, and to answer any questions that you may have.
Okay. Today, you're going to hear from colleague Deborah, Autumn, and I. Deborah is the lead on the procurement process, and it's really has all of the knowledge and experience on the procurement process. I am the person, the project person, the program person that has been able to work with a lot of you in the community to really inform the process for this RFA. You're also maybe hearing from, or other names that you may hear from, is Andrea Howardson, who's a procurement lead. For the purpose of this procurement, though, Deborah Autumn will be your direct point of contact, and we'll give an email where you can email Deborah if you have any questions or concerns. Now, to get us started, I would like to give you some background on the expanded behavioral health, the expanded rural suicide prevention training and peer behavioral health services. These RFA comes from a community needs assessment that was done in 2021 to understand what was working, what was not, and how can King County step in and fill the gaps that exist in rural behavioral health services. We also acknowledge that the COVID-19 pandemic had many challenges, and in several cases, especially in rural areas, exacerbated interpersonal risk factors to suicide due to the prolonged nature of the pandemic, quarantines, physical distancing, family separation, and isolation, lack of school, and other challenges as a result of the COVID-19 pandemic. This has led to an increased onset. We note that research shown us also that NDR quoted several at the state and national level that looks at the increase of onset acceleration of behavioral health symptoms, specifically suicidal ideation, suicide, cutting, and non-suicide cutting, and suicide cutting, and other self-harming techniques and challenges that the people, especially young people, experience living in rural areas of King County with support that may be fragmented or may be provided with by different agencies, or perhaps in some areas of unincorporated areas of King County, the services are not available. These RFA seeks to respond to the community identified needs. We'll talk about those in a moment, but the community last year came together and told us and expressed their needs, both in rural and all of the 6 rural areas, all of the 6 rural community service areas that they are part of rural areas. So these are the eligible areas for the purpose of this RFA. In the left side, you will see that's what we call the community service areas. The green area is the northeast Snoqualmie, the Snoqualmie Valley, northeast King County area. The Bear Creek and Mamish area is in blue. Four Creeks and Tiger Mountain is in orange. Greater Maple Valley is in red, and the Southeast King County is in blue, and the Vashon Maury Island is on yellow. Additionally, to all people living in these areas, people living in these small towns or adjoining towns, the language that we use, are also eligible to services. So I would say the biggest challenges about this RFA is that providers are restrictive to, given the nature of this allocation, are restricted to providing services in the community service areas in the rural adjoining towns. So that's very important for us to know. So the two providers that we're seeking under this solicitation will serve all of the different areas, either to provide peer services or suicide prevention training. Now, to give you kind of some background on the community-driven process, we also have released we're also posting a PowerPoint presentation that the Be Heard conducted last year on the results of the community engagement process. That provides a little more specificities on the data we reviewed, also the literature review that we conducted, and the results and the overall summary results of all the different ways the community serve all of the different community or the different ways people provided feedback to us. So we heard directly from community, anywhere from doing community listening sessions, provider listening sessions, but also we did a rural behavioral health survey that we received responses in multiple language and also in English. We received 700 responses. We make this to be a very accessible a survey through text, mobile, computer, whatever folks had accessible to them, they were able to complete that survey. And as a result of all of these community listening sessions, provider listening sessions, we're able to determine and apply criteria to two different programs that we seek to fund. So number one is the specialized youth suicide prevention training. These may include youth suicide prevention training, youth suicide prevention outreach, and youth suicide prevention engagements. So all of this can be done as a host of services, whether it's outreach to provide that training or engagement to accept that training or participate in the training. They're all combined, so kind of they are the same activity, but this is specifically the language that the community members wanted to see, not only the training, but also the intentional outreach and the intentional engagement with youth in rural areas to engage in the specialized youth suicide prevention training. What we hope in here is the applicants that propose on this specialized training takes into consideration the unique challenges people in rural areas experiences, the distances between their home and perhaps or the longer response times and emergency response services for somebody who is endangered to himself or endangered to others, for example. So really acknowledging perhaps the specific challenges rural communities face, and then making sure that their training content is accessible and inclusive to the people living in there in rural King County. We also see that community expressed a deep need for rural peer services. Communities wanted to experience peer-driven outreach and engagement activities that take in consideration their unique needs. Activities that are in their communities, whether if it is remote, non-remote, in person, or activities that allows the community, the rural peers to create community around themselves and to create and to really provide the opportunity for rural peers to engage in rural supportive services and supportive peer-driven engagement activities. We also saw there was a need for supportive services to build community around peers and family members living in rural King County. We acknowledge that rural areas of King County have a strong community process where we acknowledge the strength of people and support people in their own community, but at the same time, we see the need to build our skills around our mental health understanding, mental health humility and accessibility, perhaps, and understand that people living with behavioral health challenges are members of our community and they deserve respect and the ability to seek to heal and to recover. We also see that there was directly community members asked for peer-led support groups in rural areas. They wanted not only to hear from peers, but wanted the peers to really be engaged with that community and to support peers living in rural areas. And again, acknowledging the specific challenges to services, their community challenges, mesosystems and ecosystems, and all of that that is around people who are people in recovery who need the support systems to be built around them in order to ensure recovery and well-being. So again, we are posting that the PowerPoint with kind of the overarching goals and the whole engagement process and the on Zoom grants. A reminder that you're responsible for checking Zoom grants as often as possible to ensure they are up to date on addendums or additional information added to the RFA package. Now, wanted to give you kind of perspective addressing because this is a very community-driven process. This was a community-driven process. This is the community language. These are the things that community told us either through surveys or directly to us. Yes. And really allowing the to really again to be a process that comes from the community and that is responding directly to the community. So I asked that when we're looking at the most competitive process or when we're looking at the best application, we're looking for explanation why this project was chosen and how it will be community priorities and needs. This is important to us. What we're seeking from you here is to tell us how, not how the organization came with this project, came up with this project, is how the community themselves are on the project, how the community came up and told you this is what we need. But that could have been done either by your provider and the people you're providing services to are telling you, hey, I could also benefit from other services. That is a community identified priority or need, right? So you can take it, you can either engage in the process in the community to identify their needs and then present the program to us, or really look through the lens of the services you provide and what type of feedback, what type of information, or what type of services have providers asked for. I'm sorry, have participants or peers or consumers have asked for, and then therefore you're responding to their needs by applying for these grants. We also see that we hope that all of the applicants will perhaps address some of the existing inequities that highlighted by the COVID-19 pandemic and exacerbated by the COVID-19 pandemic. Wanted to know how your project seeks to address those challenges, or how will it alleviate the challenges that were presented by the COVID-19 pandemic. How the project will help reduce the behavioral health related impact of COVID-19 in our communities. We really want to hear from you, like how, again, how is this community driven? How is this going to contribute, and how the project will reduce the behavioral health system. One second, my goodness. I wanted to address how those the inequities that exist in behavioral health services as relates to the COVID-19 impact. So really acknowledging that and putting that in paper to us, and making the connect how the interventions to be provided will be directly responding to the COVID-19 impact in our communities. We also wanted to see a connection, whether it is an evidence-based practice, a promising or innovative practice. We wanted to see, we don't want to actually just put you in a box that says it has to be an evidence-based practices. You can propose a promising and innovative practices. We define this in RFA. In promising innovative practices is a practice to which you have some level of success or level of measure of success that points you that gives you a clear direction or points you towards the direction then that your approach, that your services will in fact work. But you need additional research or evidence to support your successful program. So that's what a promising innovative practices means to us. So we encourage you to really think about whether they're not evidence-based practices, what promising practices are there. We do want to know though if you're not using an evidence-based practices, why not? We wanted to know whether why those. I guess we want you to connect why does a promising practice work better in rural King County than an evidence-based practice, right? We acknowledge that the evidence-based practice also, may have a very specific, may prove the work some people and non-people of color, but when it comes to evidence with the people of colors, we know the evidence-based practices haven't accurately been tested on people or haven't been, or the data hasn't proved that completely paints the picture of the people of color fully benefit from evidence-based practices, for example. So again, all that to say is that we don't want to put you in the box. Think outside the box. Evidence-based practices, promising or innovative practices to address suicide prevention training in peer services in rural areas of King County. One second. We also wanted to see an integration of an integration of programming into a new setting, whether a new setting or no traditional setting, whether if it is a clinic, whether if it's a mobile service, a school, suicide prevention training at schools, community center, library, churches, whatever that is. We really wanted to see an integration of proposed programming into a new setting, whether if it is a new partnership, whether if you're partnering with the school systems in rural King County, or whether if you're partnering with the library systems, the church systems to provide this suicide prevention training at the libraries or at the churches throughout areas of King County. Absolutely, think outside the box and really be able to think about the new settings where you can take this programming that ultimately will benefit the community. I see a question here for Grant. Grant, if you don't mind, we'll answer that question here in a moment once we get to that, just so we can make sure that we can provide you with all the content in here. Also, outreach strategies and services delivered to culturally and linguistically diverse communities, including how language needs will be met. We really want to ensure that whatever practice or whatever training you choose or whatever approach to providing peer services the peer services you choose, or whatever program you apply for, that you have a program that is easily adaptable, that is linguistically, culturally appropriate, or can be easily adaptable to all the cultures or linguistic needs of people. We really want to ensure that whatever service you provide, that is adaptable for other people. I asked, and I think part of the application is asking to see what is your plan to providing in language behavioral health services to people. So whether if it is a suicide prevention training in Spanish or other relevant language, or whether if it is peer services to people speaking specific languages and living in rural King County. So it's really up to you, right? But we really want to see we really want to ensure that whatever you set forward that is easily adaptable and it can be easily represented to other diverse cultural and linguistically diverse communities in rural King County. Perfect. So moving forward, a big intention question is who can we serve? Who are you able to serve with these funds? We show you the map. Those are the communities, kind of overall actual communities to be served. And then the actual geographical spectrum of that when it comes to the people and the community to be served. This specific funding looks to provide suicide prevention training to youth and their families who need assistance with behavioral health challenges in rural King County. There are also language there for rural residents who benefit from programming in our services that promote connection and wellness, that is the peer services, and at the larger community for prevention purposes. So really, really acknowledging that the three levels of outreach, engagement, and interventions are the points of how this the way that we hope, or the way the community really express their needs, are representative and the different populations you're supposed that you can serve. All that to say that for outreach and engagement, any person in King County you can engage for that purpose. So whether and then when it comes specifically to the youth suicide prevention training, that is youth and their families. When it comes to peer services, those are directly to people who are in recovery or people who are consumers of the behavioral health system, or who are in whatever process of their recovery or process. So really acknowledging that all that to say the population is again intended to serve are people living, these people must be living in rural areas of King County in order for them to qualify or to be eligible for these services based on the geographical qualifications for these RFAs. I'm gonna, well, okay, I know that there are a couple of questions. Deborah, do you want to answer those questions now, or do you want to move them to the very end?
That's your call, Shamir. I'm capturing everything, so
great.
If you want to answer them now, that's fine.
Yeah, let me answer a couple of questions here. Grant, hi, it's a requirement to serve all of the services just shown. Let's go back in here. So yes, for the purpose of this RFA, you can serve people in any of these areas. So, well, we ask you to do like, MID already has relationships. We already have contracts, rural behavioral contracts in all of these areas. So we do have an in already to different communities, and we're happy to use those different relationships already for you to take on the program and start working right away. But to answer your question, yes, under this RFA, the services are CSA-wide or county-wide, rural county-wide. So all of these service areas must be served under with each of those grants. However, we're not saying that you must serve 20, 30 people in each of these or whatever number, right? Like we want to ensure that your efforts are targeted to all of these areas, while not tying you to say, okay, like in Northeast King County, you must serve this number of people, in this area, you must serve this number of people. But we want to see the efforts made to serve all of these areas. Perfect. So
okay, so wait one second, just so I understand, for clarification. So if someone is interested in maybe the Black Diamond, Enumclaw, Maple Valley area, they also need to be able to serve the North Bend, Snoqualmie, Carnation, and Duval areas, or could they just focus on the more southern areas?
So these are for the two RFAs have two different scopes in that sense. So this RFA, it has to serve all of these areas. The other RFA, participants have to pick in a specific CSA. So for these grants, given the countywide perspective to that, they must serve all of these areas. Does that make sense, Deborah?
Yes.
Perfect.
Okay.
Thank you. There's a question from Gretchen. In terms of youth suicide prevention track, could an organization propose to do several different types of training, such as youth mental health first aid, BP hours, but also classroom trainings, informal, but not BP, but also spectrum services for more comprehensive research so it can reach a wider array of people? Sorry, I think I just mumbled to all that, but yes, Gretchen. So you may propose more than one intervention to be provided, or to be more than one training to be provided in rural areas. It could be that one training is particularly would be more impactful or be more relevant to one area that has closer response times, for example, for much emergency response like youth mental health first aid, for example, and compared to other ones like the classroom YSP, for example, that could be a project, that could be a training that's more that could be better in areas like Snoqualmie Valley, county areas where the response times is whatever that looks like, right? So I guess all that to say that you may choose to have different interventions for each of your projects. Does that make sense, Deborah, for that answer? I want to make sure I give you the best answer possible.
Right. If Gretchen could respond, did that answer your question, Gretchen?
Oh, hi. Yes, thank you. I think I understand that doesn't have to be just one type of training. It can be sort of a continuum based on the community needs and can vary based on the different CSAs.
Yeah, I would say mental health first aid is already it's a contracted service already with MID. That doesn't mean that you can't that you won't be able to do it, but I guess we expect some type of partnership with our local with other provider, because they also have other resources that may be able to complement to youth mental health first aid training.
Oh, that is great. Is it in the community needs assessment information that you're going to release in terms of what is provided in these areas and what is still needed, and a list of potential evidence-based practice trainings that would be helpful for these areas?
So unfortunately, we're not going to release all that. We're going to release a PowerPoint that has all of the information that we're able to compile. So there is from the community sessions. We're not making King County, I think we're not taking a position on which intervention to use, because we really want this to be a community process. We want that decision with what interventions to take to be responsive to the communities, right? To the community you're going to serve. The PowerPoint that we released, it does have some data anywhere from economic social status, the different services being provided, and the demographics of folks, language and nationality and stuff like that. But the other or naming specific interventions, we won't be able to. We're not going to do that at this time. Is that helpful, Gretchen?
Yeah, thank you. Can I just piggyback and ask one more quick question related to that? So I did want to go back to what you were talking about earlier with the community needs assessment. And just clarification, did I hear you right that that organizations that are applying should have their own data, which builds the case for the need for the services that they're proposing?
No. And what we're saying to you is that, you don't have to present us a data-driven proposal. What we want you to present us is a community-driven proposal, right? Like whether, present us how it doesn't, like, you don't have to tell us 200 people tell us they need this service, but as a result of a service that we provide, our community have expressed needs on these or these specific needs, and therefore we're proposing a peer behavioral health services program that is mindful of these community considerations and community feedback. It's really, I guess, really, for lack of a better word, exploit the way. Not exploit, really address community needs in your proposal. That is the biggest strength you can give us in your application, is to tell us how this project is come directly from community, and whether if you explain to us the process, what do you do to get there, or whether if you explain to us that we serve people and 13 years of experience, this is what we know, and therefore we're putting forward a proposal in this area.
Great. And so if we were to say, like, yes, we serve these areas and we've heard a great need for youth suicide prevention trainings, we don't necessarily need to quantify that in terms of, like, we've heard, okay, we can just say in our experience serving these areas. Perfect.
But and explain that community, right? Like we have, like Northeast King County, for example, the Snoqualmie Valley tell us, right? Like that area has particularly experienced a high number of youth suicide attempts and actual youth suicides. So, like understanding that specific context, right? Like those are the contexts that we want you to express to us. Like in Northeast King County, we over the last months, we have seen this number of youth suicide attempts and youth suicides, which has led into our community taking a larger approach or taking a larger response on suicide prevention, and therefore we're doing this, right? Again, community at all places, and really responding to community.
Perfect. Thank you. That's so helpful. Sorry for taking up so much time.
No, I appreciate you asking those questions. Deborah?
Yes, there's another clarifying question.
If our program is thank you for clarifying it. If our program is currently serving the Southeast King County area and Greater Maple Valley Valley, Cedar River area, we need to expand to serve the remaining areas. Yes. So if you're currently already serving in those areas, that is fantastic, right? Like that's what we know. They already have that presence there. And therefore now you're just allowing those services, the expansion for people and all of the other community service areas to be eligible to those services. You don't need necessarily to have that direct presence, for example, in the other, since you're in Southeast King County, for example, you don't need to have a presence in Bear Creek, an office in that area, but you do have to have some type of outreach engagement to the other areas. We really want every, whether if your office is focused out of one CSA, we really want to ensure the reach and engagement and the intentionality of your work also reaches other community service areas. And I would say that is the strength of this RFA too, is that it's really community driven. This is what the community have asked for. This is an opportunity for the providers, for you as a provider to be very direct and responding to community. So we created this RFA with intentionality again to like really will give you these overarching goals of what the community wants to reach, and then allowing you to then propose us something based on that. So to answer your question again, Grant, yes, you will have to expand to that to remain to the other areas to serve those areas. That doesn't mean you need to open an office in those areas. That just means that your services need to be able to reach those areas. Okay, appreciate that. Just kind of demonstrate the capacity to serve that entire area. Understood. There we go. Thank you. That's a really good way. Thank you. That we're looking for the demonstrated capacity for you to expand your ability to serve those areas to other than the area that you're already serving. Thank you very much. Appreciate that. Thanks. Perfect. Awesome. So I'm going to turn it over to my colleague, Deborah, who's going to walk us through the actual application process on Zoom grants.
Okay, Schmeiers, can you? Thank you. So as you know, the RFA was issued March 17th. We're having the application workshop today. The final day to ask questions is April 20th, and you can reach me through the DCHS contracts at kingcounty.gov email address that will be shown at the end of this presentation. The applications are due on May 3rd. Then we'll have the evaluation period through May into June, notification of selection in June, and then the contract start date around the 1st of July. We will go through an administrative review process to meet minimum qualifications, and those are listed in the RFA. The applications must be complete and responsive, so please take care to make sure that you answer the questions clearly. We will have a review panel selected of King County employees, as well as staff members, as well as people from the community, perhaps even someone from council. That's still being planned at this time. The applications will be reviewed and scored by the panel. The highest scoring applications will be recommended for a contract. If we may determine that an interview is needed, depending on if we're able to make a clear determination by application only. And you would be contacted in that regard, or we may reach out with some clarifying questions, and all of this will be done through Zoom Grants. You'll receive an email from Zoom Grants with questions, perhaps additional questions that need to be answered to clarify some statements that you may have made in your application. Then the applicants will be approved by DCHS leadership. Next slide. So Schmeiers, why don't you go ahead and explain your rating criteria?
Thank you. Yeah. So we have a 1 through 5 kind of weighting score. A total of 100 points that will be awarded. This is kind of the way they were going to review the criteria 1 to 5. Really, a 0 is at no value. That means the response that we received to a specific section. In the narrative document, you will see that there are a number of points to each of the questions associated to that. So all of those points will equal 100 points. And ultimately, the highest score will be the ones that will be awarded. Also, we see a 1 to 2. That's an average that is really, really below average, and looking at only minimally addressing the response, whether this is a one-line response answer, or we were told look above or see below, whatever that looks like. Honestly, please give us that. Really give us the content, give us information, the full picture. I think that the review panel always enjoys not having questions and just really knowing what's in front of there, how this comes from community and responding to community. This we see 3 as an average response that showed that you have response to the question, but that was the minimum. We have not seen an additional content, or you told us this is our response that we want to do, but we've been connected with the RFA or with that community needs that this would be primarily serving. 4 to 5 and it's above average. The greatest score you can get. This is a response that's thorough, a response to complete and demonstrate a full understanding of the concepts and requirements of the RFA, but full understanding of the challenges that people in rural areas experience. So I ask you to seek to have a score above average and really give us a response that is full, complete. They give us and demonstrate to you have full content and knowledge of the challenges people experience on rural areas, but also on how your interventions will contribute to the success of that community and the well-being of that community. So this is kind of overarching to that. We will score you based on these, and we ask you again to really give us full answers with full connections between the RFA and community identified needs.
And the list of questions are in Zoom Grants. And if you have any questions about the questions, please feel free to reach out to me and we can provide answers to those questions via an amendment to the RFA that will be posted on Zoom Grants. For example, after today's meeting, I will be capturing all of the questions and answers and incorporating them into an amendment that will be posted on Zoom Grants. Okay, how to apply for this RFA. You will go out to Zoom Grants. Again, if you have any questions about how to log into Zoom Grants, please feel free to reach out to me.
Oops, sorry.
We will be doing this, thanks, Shamir. We'll be doing this application process a little bit differently than we normally do, because we're asking you to basically download the application and complete your application offline, and then to upload your application and all your supportive documents back into Zoom Grants. Typically, we have you answer the questions in the Zoom Grants portal. We're doing it differently this time because we had so many questions that it exceeded the limits in Zoom Grants, and we had a split of questions that we wanted you to answer. That's why we're doing it this way. So once you complete your application, then you would again upload your application into Zoom Grants along with any other supportive documents to include the budget document. All of those attachments are included in the RFA for your download and for your use as templates. And there is my email address for your use if you have any questions. Next slide. Applications must be received in Zoom Grants no later than 2:30. It will be closed at that time. Please don't wait till the last minute. Sometimes there are glitches in Zoom Grants that you'll need to reach out to their help desk to help you resolve them so you can get your application submitted on time. So please don't wait till the last minute. Again, applicants are responsible for regularly checking Zoom grants for any updates or amendments, like I mentioned earlier. Again, if you experience technical issues, please reach out to Zoom Grants Help Desk. They're very responsive and they're very helpful. And you can also reach out to me via email. There's a question, could you speak a little bit to the potential for continued funding after the end of the grant period?
Oh, there you go.
Ramirez, want to answer that?
Yes. So, so the MID, or the Mental Illness and Drug Dependence Unit, currently has what's called the Behavioral Health Services in Rural King County Initiative. That is an ongoing funding initiative that they provide funding on a biannual basis. This specific funding is an ARPA allocation that will expire, right? So once this funding is gone, it's gone. However, the ongoing behavioral health services in Rural King County will continue. That is a continued funding initiative. They will continue to allow for funding to have to continue capacity in rural areas of King County. So as of this time, this specific funding you may be applying for is not going to be expanded. However, there are other funding sources like the behavioral health services in Rural King County that will continue a portion of this work.
Can I ask something on related to that? So yeah, because I saw that there was a question on sustainability.
Yeah.
And so, I mean, I hear that MID has funding for the stream, but is it, I don't know, do you feel like there's we can say 90% that this will be available?
I honestly cannot say that to you because I really don't know. I think that MID has a commitment to continue funding rural King County. I think that right now because this is the initial allocation or the first large investment in rural areas that has been made, and could potentially lead to more. But unfortunately, as of right now, there's no more funding to it. What was the first part of your question? I think I missed that one.
Yeah. So thank you. I needed that part of your answer first. So then for the sustainability question, are organizations expected to, I don't know, figure out how to sustain it? Or?
So actually I did. So that's a little bit of a good and tricky question, because if you, in the RFA, we ask for your sustainability plan to sustain the program. And if we ask, and if there is no current funding, continuous funding, or there's no way to sustain the project with the current funding, what type of continued funding will be ideal, will be best for you to keep consistency of services in rural King County? So we asked that question there for sustainability, but we're also asking, but because we know that too, the sustainable is difficult to have sustainability for this type of things, so we want you to describe to us what type of funding will work for to keep this consistency, and how, right? Like really express that to us. I will say MID makes a lot of decisions based on what we hear, what we read on application. So guide us through that process. Tell us if this funding is going to expire. Tell us there's no other funding that will allow us to keep this work, and this is the type of funding that will allow us to keep consistency of services in rural King County.
Right.
Okay, great. So
yeah.
Go ahead, Deborah.
And as you're aware, King County has to pass its budget every year. So sustained funding for various programs after federal funding ends, like this is ARPA funded, will be based on those proposals that are presented to the council for those decisions. So by us asking in the RFA what continued funding will be needed to sustain the program long term, that provides Ramirez and his team the information they need to make those proposals to the county to continue that funding year after year.
Thank you,
That's so
Deborah.
interesting. So it's almost like a little community needs assessment from the CBOs or either different.
It is. So MID is very intentional, and I asked you to read the RFA a couple of times. I think, and not because I don't think because we put messages there, and I hope that you all use our language in the RFA. Use what you see there in the RFA. I think that is important to MID, but also tell us at all times, like because we make the decisions. This is MID is a behavioral health tax. It's a MID is a community-driven program, and we want to make funding decisions based on what the community tell us that works and what doesn't. So it's, again, to elaborate what Deborah says, your feedback will help me make funding decisions for the future. While right now we can't, obviously, I cannot make a promise that funding will continue, but with that information, I will make a pitch for it. Thank you. Deborah, the next slide is are we going to do this, the application demo? You're on mute, Deborah, up there.
Yeah, thank you. Actually, no, for some reason, I'm not able to get into Zoom grants now.
Yeah.
I wanted to know, though, how many of you, I guess, are not familiar with using Zoom grants? Anyone?
I'm unfamiliar. Here, Sarah Stratton at Rainier Foothills.
Okay, so what I can do is, there you go. Well, you can see it. Yeah, so Ramiro, you're in it now.
Yeah, so I put, this is the link that is where the RFA is at, where you will be able to to preview the whole package. So once you go to the link, you'll have the opportunity to see the whole procurement and all of the attachments. So this is the actual RFA and all the different attachments you're going to you need to fill out. So and once you're ready to apply, then you're able to actually apply. You have to create an application. You have to create an account to which the for your organization and portfolio in order for you to upload the documents to the system.
Great. And we just ask that you make sure when you download your application, make sure your application is complete when you re-upload it into Zoom Grants. And it'll walk you through that process. And then before you hit complete and submit, just make sure you've uploaded all the supportive documents that you need, like your budget and the answers to the narrative questions.
We also have a contact admin here, so if you like, you can send it directly here. But anyway, so this is, spend some time here. There are a lot of things in the RFA that are really intentional to really walk you through or provide some couple of information or things that are to help you or to help you make a good decision in the RFA. So
Right.
this is
and
it,
Sarah,
Sarah,
if you have any questions about Zoom Grants, please reach out to me. I'm happy to help.
Thank you. I appreciate it.
There's one more question in here from, let's see, let me put this up. The question is from Grant. Let's see. Clarifying that there will be only one award for each of the 2 tracks. Yes, it is. We're only going to do one award for each, $300,000 award for each youth suicide prevention training and the peer behavioral health services for an 18-month project. The second part is it possible for organizations to only apply for one track? Yes, you can only apply for one. You can either apply as a collaborative, 2 organizations coming together, one taking the one part and the other one taking the other part, and you can apply together. or you can, if one organization is applying for both programs or both scopes, we ask that you submit separate applications for each of them. We're likely to score them on their own merits, on his own thing, because we really want to ensure that we're looking at each of these programs its own merits and its own ability to reflect the community needs. Yes, you can either apply collaborative, you can apply for one project with one track only. Is it possible that one organization apply for and be awarded both tracks they're looking, and are you looking to the different orgs? Honestly, I think that if one organization has the experience capacity to both, again, we ask you to submit 2 separate applications for each scope, and will be scored on its own merit, or ask you to partner with somebody else. So I think that the best possible thing for us that you can do is to partner with somebody and to bring a collaboration and to leverage the strengths of both organizations to better serve the community and those 2 different scopes of work, while simultaneously working together. Does that work? Does that answer your question, Grant?
Yeah, that was from Gretchen, but yep, that sounds great.
Gretchen, sorry. Sorry, thank you all very much. Perfect. Are there? I guess we have gotten to a point of the presentation today where we can answer any questions, concerns you may have, or we can provide you with any other information you may need. Let's see. I'm gonna put up my. Oops. Can you see my slide? Yeah. Are there any other questions, folks? No. Okay.
So just as a reminder that we will be posting the presentation today, as well as the audio, the video, or the recording, and the answers to the questions that were raised. Chalmers, there were also a couple of questions that we received via email before the meeting. Okay. Did you want to go over those?
That would be great, actually, yeah.
All right, so the first question was, do you anticipate one organization will be awarded the YSP and another organization will be awarded the peer services work? Or should nonprofits who are applying expect to be willing to do both services? We kind of answered that question, but I will read the response that King County came up with. We welcome collaborative applications where each partner takes a scope of work to best serve the community. If a single applicant is applying for both scopes, the applicant must submit separate and unique applications to be reviewed and scored on its own merits. So question number 2 that was received, the community engagement process referenced in the blog post sounds like it probably has some rich data that would likely be helpful for us to know about in general and potentially use in grant applications. It's hard to find updated data that reflects our current reality during COVID. Could you share a summary of the survey, listening sessions, literature review, and analysis of service utilization? The answer is DCHS has released the attached presentation of the 2021 Rural Community Needs Assessment that informed these RFAs, and we will also be uploading that presentation. Is that correct, Shamers?
Yes.
Okay. Are there any other questions for today?
Hearing none, it's really, really great to see you all here today. We really need you partners in our community. We really need your collaboration. This RFA is to me as a person who did the community engagement process, is really, really intentional. We knew itself. We knew. We talked to people directly with people and consumers, people in recovery, and it was really great for us to see that level of engagement of the community and the intentionality behind every piece of information, every recommendation they made to us. So I ask you to do the same in the community as you're applying for this grant, to be really rooted in the systems of care of the community, rooted in the principles of equity and inclusion and social justice, and overall to really serve the needs of the rural residents who have traditionally experienced some challenges with services, and with this funding we seek to finally bridging those gaps that exist in services in rural King County. So thank you all very much for being here today. I hope to see you all apply for this project soon, and I look forward to reviewing your applications. Thank you all very much for being here today.
Thank you, everyone.